Today is World AIDS Day. BC has the lowest infection rate of HIV in Canada. In fact, the rate has dropped by 90% since 1996. As Dr. Meera Dalal reports, universal screening might be the next big step in combating the disease.
Jeff Seeley has lived with HIV for more than 10 years, but the initial diagnosis came as a bit of a surprise. Did you suspect that you might have it?
No, actually, I did not. I knew I was hepatitis C. I'm glad I found out so I could get the medical attention that I needed.
In fact, 25% of people with HIV don't know they have the virus. Symptoms of HIV might not show up for 10 to 20 years after infection. This prevents those affected from getting early treatment and greatly increases the chance of them spreading the disease. After an extensive cost-benefit analysis, the Center for Disease Control in Atlanta suggests that HIV screening is justified if even 1 in 1,000 people is caught. Last year, health authorities started a pilot project where they screened everyone admitted to the hospital for HIV. For every 1,000 people screened, 7 people were found to have HIV, which was completely unexpected. Dr. Julio Montaner has led the charge in BC's fight against AIDS. He believes it's now time to screen everyone, not just those admitted to the hospital.
We strongly recommend that the test be offered to anybody who has been sexually active at least once in the last 5 decades.
But Canadian law dictates that once aware of HIV, people have an obligation to disclose, or they could face aggravated assault charges. And while patients are always asked for permission before the test is taken, critics of universal screening say they don't always know what they're getting into.
Let's say you are in an abusive relationship and you were to test positive. With that knowledge now, you have to go home to your abuser and disclose. Or the possibility that you could later be charged with aggravated sexual assault.
The test costs a little over $10, while treatment for unrecognized HIV-related disease can range from half to $1 million a patient, which some experts say makes the math a no-brainer. Dr. Meera Dalal, CBC News, Vancouver.